we're about to start. Dr. My name is Dr. Ya.
Hello, beautiful people. It has been the longest time. I mean, since 2022, we went to 2023, and now it is 2024. You haven't seen Ifwa doing chubby, chubby, chubby on your screens. Now I am back, and I am not going anywhere. As you can see, we are here once again on the Two Worst Moms show. As I'm sitting here, you can see how beautiful I'm looking. My makeup is by the one and only Frames Touch right here in Takrady. And then my beautiful dress from Appearance Trendy. As for the sneakers, it's from somebody, so I will not talk about it now. That'll be a topic for another day. I am so excited to be here and I can't wait for us to delve into this season, talk about various topics, have a lot of fun, and then get some lessons on motherhood and parenting in general. Today, I am here with Doc. Doc, that's all a pediatrician and a pediatrician because me, I don't know.
Pediatrician.
Pediatrician. I am here with Dr. Appiah Nkansah. She's a pediatrician at the Appiah Nkansah Hospital. Now, the World Health Organization says that out of every 100 kids, okay, out of every 100 children, one has autism. I think it's called the autism spectrum disorder. Is that the
Yes,
right
yes.
word for it? And around me, in my personal life, I have seen many people whose kids are going through this. And this is the best time to talk about this. So today I brought Doc. I went to drag her here all the way from Appiah Nkansah. Come and have this discussion with us. Doc, Akwaba.
Thank you. Thank you, my sister.
I'm very happy that you graced our studios today.
Thank you. Thank you.
Okay. Before we go into autism, I want to ask you. I mean, I've realized how very passionate you are about your job. Why did you choose medicine? Why did you choose to be a pediatrician? I mean, you could have done many other things. Why did you want to tackle kids?
Hmm. I did not want to be a pediatrician.
Oh,
So after my house job, after medical school, you do 2 years mandatory house job where you rotate in every department or the four major departments, and then you choose where you want to be. So I wanted to be a cancer doctor, an
hey,
oncologist.
hey, big
So
dreams.
yes, yes. So I was actually in the department of radiation oncology at CAS, Kumasi, for
Okay,
2 years,
okay.
and I actually wrote the exams to start, and uh, uh, then later on I just had a change of mind. But then the four main disciplines are usually obstetrician, gynecology, the women's issues,
Yeah.
surgery, internal medicine, adults, and then pediatrics. And then I said surgery. No, I don't want to be standing for long in theater out. ONG. I like the women, I like the babies, but it's too bloody out. Internal medicine, sometimes you don't see much progress
And then you
out.
landed on
Then
the left.
pediatrics.
So let me quickly ask you this. You have three kids.
I have three, I'm a mom of three kids. Yeah.
Yeah. Yeah, mom of three. How has it been? Within like the shortest time, tell me how has it been combining being a doctor with having kids, taking care of kids?
It's been difficult, it's been challenging,
Mm,
it's been rewarding as well.
mm,
Because you see, the sorts of things that you read in the textbooks, you are actually experiencing some of them in your own home. So it makes mothering a beautiful experience.
mm.
I also think that it has also been a bit easier for me because right now I'm a senior doctor, I'm a specialist. So I don't have to do night
Yeah,
duties
yeah,
like I used
yeah.
to do as a junior doctor, you know.
I understand it.
Now, unless of course it's a dire emergency, I wouldn't have to go to the hospital in the deep of
Dead
the
of
night.
the
Yeah.
night. All right then. All right
So
then. All right then. Now let's quickly. I mean, sorry, I forgot to apologize for the delay. We had a few technical setbacks. So, Doc, autism, Ankasa. When we say autism, me when I was a child, whenever I heard autism, I mean it was over the moon for me. Like this is a serious disease. You're not even supposed to go close to those who have autism. Autism itself, what is it?
hmm. So it is said that autism is a neurodevelopmental disorder.
When you say
So
neurodevelopmental.
neurodevelopmental means that there is a problem with how the brain works.
Okay.
Yes. So autism is a neurodevelopmental disorder that has variable severity. So it ranges from mild to moderate, through moderate to severe. So you can have a child with mild symptoms a child with severe symptoms, right? Every
Okay.
child with autism is unique. Each child is unique. Okay. Now, this
Oh,
condition is characterized by certain behaviors. So there are difficulties with social interaction,
yeah,
there may be difficulties with speech, there may be repetitive behaviors, rigidity.
yeah.
Some children with autism actually are sensitive to certain stimuli, like light. So in bright light, they'll cover their eyes.
Hmm.
Loud sound, they'll cover their ears. They are sensitive to certain textures, even food textures. So some of the children with
Hmm.
autism, they wouldn't accept to chew their food, although they have teeth and they can chew. They
Hmm.
only want blended meal. And because the condition is unique to the individual, the symptoms or signs may vary. But to come out with the diagnosis of autism, lots of time. So the child has to be screened.
Doc, you wait. We'll get there. Before we talk about the diagnosis, a mom or a dad may be home and they don't know what the signs even are. So let's talk about the signs and the symptoms. Okay, the early signs. What are some of the things that the kid will do for you to know that my child may have autism?
Okay, so it depends on the age of the baby. Okay, so let's say if you have a 9 month old, a 9 month old should even be saying some mama dada. That
Really?
yes,
9 months.
9 months. That's when they
So if
start
they're
to
not
say. So if you
saying
have a 1 year old who's not saying mama dada, 9 months they wave bye bye, respond to bye bye. You have a 1 year old not responding to bye bye.
it's not speech delay.
So you see, it's difficult to differentiate between speech delay and autism.
At that early
So
stage.
it's so for us to know that it is indeed autism. So the child might have the symptoms of maybe delayed development. So if the parent sees any of these things, then you have to now get to your healthcare provider, and then you use the screening tools just to screen. It's not to diagnose the autism, to
Okay.
screen that this child has some symptoms of autism. So after that, they will now send to the pediatrician or the neurodevelopmental pediatrician who will now diagnose autism. Now, a lot of children in Ghana are actually screen addicted, and screen addiction to give symptoms like autism. So yeah,
Screen doc, wait. When you say screen addiction, what do you mean? Watching cartoons.
so this cartoons thing they are doing, and then especially this cocoa melon, they can watch it for hours.
Yes.
And then we have seen a surgeon.
But please, I don't mean to cut you. A lot of people say it is educative. Not Cocomelon per se. Most of the cartoons. Some people claim it even helps their kids to speak good English. So if you are saying that it is not good, please, what are the side effects? This is really interesting. I want to know
Yes,
more.
so the screen is not natural, like maybe it's not a natural human interaction. So let's say if you have a cartoon on the TV saying that speaking to the child or singing to the child, it's a monologue. So the child only hears and is not given the opportunity
To
to respond.
express themselves.
So they will listen, and some of them they can even sing some rhymes.
Yes.
But to even respond to your "How are you" will become a problem. So it's
Mm,
important that we take them off the screens. Many children who have autistic traits, when you take them off the screen, within a few months, they are off. Some of them, even within days. I have seen children
mm.
within 2 weeks. They were not talking, almost 3 years, they were not talking, they were hyper, they cannot maintain eye contact. And then we take them off the screen. Within 2 weeks, they are talking. So it's important
Wow.
that the parents understand the dangers of overuse of the screen. One, the screen emits radiation straight into the brain, electromagnetic radiation, and it can overexcite the brain. So I have even met
Oh.
children who had seizures after watching the screen for so long.
The hyperactivity.
Yes, the lights, the bright light. You know that if you look at these children's cartoons, the colors are so vibrant. You don't see
Yeah.
these colors in nature, and they
Yeah.
can overstimulate the brain. Okay, and then we
Mm.
also have a hormone in the brain called melatonin that helps us to sleep. So when you do too much screen time, you reduce your brain's production of the sleep hormone. So
Hey.
those children now stay up at night, they cannot sleep, they'll be hyperactive, they'll be up going up, down screen.
Please, I hope you are listening. Oh, I hope you are listening.
Okay, so it's
Wow.
important that we limit the screen time. But if we have a child who is developing, meeting the milestones fine, okay, ideally every child is supposed to go and see the pediatrician. In the US and other Western countries, they will be seeing the pediatrician until they are either 80 years or 25-year old. Okay, so
Oh,
regular
but not
checks.
in this Ghana.
Ghana, we have a lot of illnesses that deserve attention. So sometimes it's
Yeah.
difficult taking your well child or your seemingly well child to go and see the pediatrician
Yeah.
because you're going to join the queue. People are coughing, people are having diarrhea, and your child too is seemingly well. But your child may have a developmental problem,
Issue. Yeah.
which if maybe a professional sees, we pick up early and then we intervene so that the child doesn't now develop full-blown autistic symptoms. So a lot of children come in, we screen them, and it looks like they are on the autism spectrum. But you take them off the screen, you introduce some outdoor activity, you do one or two tweaks in
Like
their not, and
sporting,
that is
running.
all. You understand? But those that have been seen for let's say months, 6 months to a year, and they are not improving, those
Mm.
are the ones that you say that they really have ASD.
So, doc, at which age can the doctors, really diagnose that the child is 5? Now we can see boldly, we can boldly confirm that they have autism.
So it depends on the age where the child is coming up. So let's say the child was delayed and now came to the doctor at the age of 7 years old.
Yeah.
Okay, so the child would have been screened, and then the child will now say, okay, this child seems like a child with severe autism, but there is a screening tool and there is a diagnostic tool. So after we screen, we will now refer to, let's say, a neurodevelopmental pediatrician who will now put it together and now diagnose it.
Sorry, a
But
neuro what?
a neurodevelopmental pediatrician.
Are they
So,
the
so,
like the experts
so they
in
are
autism?
subspecialists. So they are experts. So they are sub. So I am a pediatrician.
Yeah.
So I can say, oh, I want to just focus on children with neurodevelopmental issues. So I decide to
Mm.
go to UK or to train further. And when I come, I just don't see any pediatric case, any child. I just see children with neurodevelopmental issues. And there are many of them, and they look similar. So you can have a child who has an anxiety disorder, a
Mm.
child who has an attention deficit hyperactive disorder, a child with a speech or language disorder, a child with autism. And in the initial stage, it's difficult to say this is it. So usually, yes, with autism, it is thought that it cannot be cured. So if all
Yes.
interventions have been given the child and the child does not improve at all, then you say, okay, this one is autism. So that one is not a diagnosis that you just say, oh, my child is autistic.
Mm.
It takes years. I know one
Wow.
neurodevelopmental pediatrician, she will see the child for about 6 months, do all interventions before
Before.
saying that, okay, this one is, uh-huh.
So, I mean, when you're talking, the last time I was in your office, you did say it, and you just mentioned it. It is quite common to hear that autism cannot be cured. Is that true?
So that is one school of thought. They say
Okay.
that autism cannot be cured. But there are some children who are picked early. And in my experience, the children who appear to have the signs of autism, who are like, let's say, up to 3 years old or less than 3 years old, some of them, when you give these early interventions, then they now you come and use the screening tool again. They don't even meet the criteria. So it is
Yeah.
easier with the children who are younger, especially those who are less than 3 years old, right? So it's important that we pick these children early. We screen them, like maybe we put these screening tools in the weighing centers so that we screen these babies and infants so that anybody that needs to be seen is referred to the pediatrician, and then we start the intervention early because some of the children they could have been helped, but they will be, let's say, 5 years, 6 years, 7 years, they've even forgotten how to use their vocal cords to talk.
Mm.
So now the vocal cords now become paralyzed, they cannot talk.
Doc, so let's say a child is 4. Besides mama and dada, the child can't say any other thing. When you call the child, they don't mind you. They always seem to be in their own world. If it is TV they are watching, they are very fixated. Even if it is food they are eating, they are, they are fixated. They don't want to interact with any other child. Something like that.
Yes.
Even if they are saying mama or dada.
Yes. So this child is exhibiting traits for autism. So
Okay.
screen and grade it as mild, moderate. There are many questions that will ask the parents, then come to a conclusion whether the child has mild autistic traits or not, or moderate or
Okay.
severe.
So please hold your thoughts. Viewers watching, we'll be reading your comments. So please send in your questions and leave any other thing that you want to leave in the comment section, both on YouTube and on Facebook. And please don't forget to share the link. Don't forget to share the link. We'll be waiting. Doc, please continue. Or you've lost your school of thought, so let me just quickly rush to the next one. So it means that prevention is better than cure
Early
in
detection
this
is the key. Early detection.
early detection. But how
Yes.
can we prevent it? Because so far as I mean, you, the medical field, you, the people in the medical field, are saying that curing it is a problem, is an issue. How can we just prevent it?
Hmm. So one school of thought says that there's nothing that you can do to prevent it. If maybe your child will have
Hey,
autism, your child will have it.
hey.
Because the cause too is largely unknown according to one school of thought. So if
Okay.
you don't know it, then how are you going to prevent or cure it? But
Hmm.
recently too, there have been researches um, that show that autism may be a gut problem. So by gut, I mean digestive tract.
Yeah.
Because you realize that the children with autism, they usually have gut issues. So they may have some difficult bowel movements, constipation, sticky, pasty, offensive stools.
Wow.
Yes. Okay, so it's a gut problem. Some people think that it is a systemic problem with brain manifestation because children with autism, apart from the gut issues, some have skin issues. They have sensitive skin, easy to scar, small insect bites, develops a swelling, it leaves a black mark, you
So
know.
all those things can be symptoms of autism.
So it's an association, right?
Hmm.
So they usually have issues. So some of them they will scratch, scratch, scratch. So some of them too have breathing issues as well. Some of them too behavioral. So some may appear a bit hyperactive than normal. They may be pacing up and down. They may be
So
banging their
it's
head.
not normal for a child to be pacing up and down all
Eh,
the time.
So you don't just look at one symptom and say that my child is autistic.
Yeah.
You have to put it together. So that is
Yeah.
why it's important that if you see even one and you're not sure, just go to
To
your
the
doctor and then ask for the child to be screened.
So how about the people who want to pray about everything? They'll not go and see the doctor. They'll say, "Oh, we'll pray, it will go."
Prayer is very good. We are all here because of maybe our parents' prayers and all that.
Yeah.
But God has also given health professionals the know how to help
Yeah.
with certain conditions. So you add your prayer and then you seek help for your child. All right.
Okay. When the person, maybe a child is now diagnosed with the autism, do you have different ways of treating it, or is there a particular, the most effective way of letting it subside since it will not go forever?
Okay. So usually there are certain interventions that the child will have to be taken through. So I always look at the holistic development of a child. So treating a child with autism is multidisciplinary. So there is a place for speech therapy if needed. There is a place for behavioral or occupational therapy. There is a
Okay.
place for even diet. All right. Okay.
Doc, please, I beg you. Can you speak just a little about the diet? Because I'm surprised myself that, something that is in the guts can even connect with it. I mean, you and I have had this conversation, but for the sake of our viewers,
Okay.
yeah,
So
the guts and the brain,
so there is a gut brain connection or a gut brain axis. And in recent years, research has proven that so many conditions are linked to the gut health. So, you have healthy organisms in your body. We call that normal flora. So these healthy organisms, they should live in harmony with bad organisms.
in
So
harmony.
harmony, yes. So at every point in time, you have healthy organisms living in your body. But we want to, even on your skin, eyes, everywhere. I want to focus on the gut or the digestive tract for the purposes of this discussion.
Okay.
So these healthy organisms must not be overpowered by the or outgrown by the unhealthy organisms because they keep your immune system in good shape, the healthy organism. All right. And we have certain brain chemicals that help give somebody very good brain development. And some of these chemicals are actually produced in the digestive system. So anything
Oh.
that affects those healthy organisms affects your brain health as well. Yes,
Oh.
so that is why usually the children on the autism spectrum they have gut issues as well. So some people think that it is primarily a gut issue with brain manifestations. Okay, so even the healthy flora or the healthy organisms in our gut, they also need to live and survive. So you even have to feed them. So if you are doing a diet rich in, let's say, fresh fruits, fresh vegetables, you get proper fiber, proper
But
nutrition
doc,
for your.
our kids, they don't like fruit and vegetables, though.
Yes, I know. I know that
So
it's
how do we
difficult.
go about it?
It's important to start early
Okay.
because usually, even if you are doing exclusive breastfeeding, by the time you are doing exclusive breastfeeding, whatever you are taking in as a mother, you get into the breast milk and influences the taste of the breast milk.
Mm.
So a mother who, let's say, loves her junk food, highly processed diet, the child will also be tasting it from the breast milk
So
and
the
develop
moms who have been eating pizza,
all the
shawarma,
time. You can have
boxed
it. You can
fruit
have it
juices,
once in a while.
it
You
should be
know,
once in a
you can have it
while,
once in a
not
while,
every day.
not every day.
You have to cook proper food
Exactly.
like vegetable
These
stew.
are normal Ghanaian, natural Ghanaian
Yeah.
fufu, banku, all those are Ghanaian foods.
Okay.
They are healthy
Mm.
because a lot of the children with autism they are actually fixated on one food, and most of them are addicted to junk food. So some of them you can meet a child with autism or
Mm.
autism on the spectrum who just eats pizza or
Hey,
chicken nuggets. So then you have to be firm with the mother that no
the
pizza.
chicken nuggets, they're not
So
healthy.
the process that is all the child is eating. No,
Oh,
if
okay, they're not
if
getting
the
the
family is
other.
eating wache, the child has to eat chicken nuggets.
Wow.
If the family is eating fufu, the child chicken nuggets. Do you understand? So now you have to now tell the mother that make a conscious effort to be disciplined. No pizza in the house, no chicken nuggets. Let the child eat the food that the whole family is eating, right? Because we know that autism is a neurodevelopmental disorder. So if there's something with the brain, does the brain also need food? Yes. Whatever we eat is absorbed from the gut into the blood. Blood flows everywhere to nutrify your brain. So your
Hmm.
brain too needs proper nutrition. So your child is already having difficulties with social interaction. And then the blood that is flowing through the brain is full of chemicals. No vitamin C, no vitamin E, nothing, only chemicals. Your child will not develop. So it's
How?
important that even the gut
So
issue, we
please
tackle
run.
it.
Yeah. So now run us through the treatment process.
Okay, so for a child with autism, they will need some kind of behavioral therapy, right? The screen is the first thing that we have to take off. In fact, a
Mm.
lot of I know one neurodevelopmental pediatrician who says she sees about 20 cases a week, 20 new cases of autism
Wow.
a week. And she was linking it to the COVID because it seems as if the mothers who took the COVID vaccine or had COVID infection too, they had these children. So we don't know what COVID's
Really?
role had to do with it. Was it because of the lockdown? People had the children were in the house watching cartoons
TV
all
all the
day
time. Yeah.
and maybe snacking on junk food, or was it because the mothers had COVID infection and maybe because of that it's maybe affected the babies they were carrying, or was it because of the vaccines that maybe
But
because
sorry, if you say that, does it mean we can associate COVID with autism?
COVID and autism?
Yes. If they took the shot.
They cannot tell whether it is from the COVID infection or COVID vaccine. They are not sure.
Wow.
But there has been a surge after COVID. So that is why people are
Exactly.
making an
Exactly.
association with the vaccines that some of these mothers, maybe they were
Mm.
breastfeeding, they took the vaccine because they had to keep their work, their job. Does it have any correlation? We are not sure.
Mm.
But there seems to be a surge after COVID.
Mm. Mm. I want to ask you this, and then we'll go if we have some questions and comments from um, the comment area. We'll go for that. I want to ask that. Let's say a family now they have maybe they didn't realize ahead of time that their child was suffering from this, and then it has gotten to the point where it has gotten out of hand. Are there available resources in this country? Because for Ghana, me, I can't talk for us anywhere I go.
Mm.
Even sometimes there are available things, sorry, and then we don't even know. We are not even aware as a country, as a people, that we have these things in store, that we have these systems in place for such people. So please, since you are in the medical field, what are the resources available for autistic children, for the families, to use? Yeah.
Okay, so that's for the resources. It's an issue. There, I know of two neurodevelopmental pediatricians in Ghana, and both of them are in Accra. But there are other pediatricians too that help see children with autism. I know of patients that leave Takoradi to Accra to go and access a new developmental pediatrician. So we would encourage our pediatricians to subspecialize in neurodevelopment so that they can take the burden of these two. All
Okay.
right. So apart from that, we need speech therapists. Usually, the neurodevelopmental pediatrician or the pediatrician will see the child and start some measures even before they see the speech therapist. Right.
Okay.
So we are taking the child off screen. We are increasing maybe outdoor exposure, getting some sun exposure because vitamin D has a very good effect on brain
Yes.
development.
Yes.
We are getting the child to meet human beings. They go out. So one of my senior colleagues, she recommends the mothers taking their children to the markets, Makola market, where it's so busy. So these children are usually sensitive to sound and light, So maybe first day they are uncomfortable, but after 3 1-hour trips each to Makola market, they change. So we actually have to let them get out there and
Out
play
of the
in the
house.
sand, in the
You see, I was recently discussing this with my husband. When we were kids, no, we are seeing you home.
yeah.
So we could go out, our parents will be in. I lived with my grandmother and she'll be inside and see Mabel. You play her, then you hear your name. You run home, you go and bath, you eat. But because of the kind of stories we hear these days, everybody is keeping their kid. And also, there is this thing I realized when I grew up. I think some people think that when you keep it is rich people who keep their kids inside.
It's true. The rich people
Right?
tend to keep their
Yeah,
kids.
yeah. And I don't know where that mentality came from because honestly, we have to bring up the kids to be able to face people, to be able to stand in front of people and talk.
Yeah, that's
But
true.
somehow we end up overprotecting them. Because me, when one of my kids, when you told me that I had to let them go out, I don't know if you remember, yeah. I think it was Chadwick. Initially, whenever he went out, I would follow. Even though the house is walled, there is this fear in parents. So I think sometimes we can't really blame the parents. There is this fear that obi bechemeba, obi bede, and some are also just lazy. I mean, if they are playing, you have to go and sit there and monitor them. We rather
Exactly.
prefer pressing our phones.
Exactly. And say doctor says you should go for 1 hour sun exposure, go. The child will see it as punishment. So all of you are
Yeah.
going for that sun exposure. You are going for the walk. You can make it interesting. Maybe if you have a bicycle, a tricycle, they should go. Have play. If you have the money or the means, you can get your trampoline. You can, let the child play outdoors. But yes, you have to keep an eye on the children because you never know who come and try and kidnap your child or maybe your child
Yeah.
could get hurt. So
Yeah.
it's
So it means you,
important.
the parents, not only the moms, the dads too.
Or an
We
older
all
responsible sibling or
person, yeah,
caregiver
we
should
all have to
supervise the
be
play.
involved
Yeah.
in this. Okay. Please can we go for our questions and comments? Okay, so while we are waiting for that, look, let's say on an average, because me this TV thing, it is it is really important to me because myself and many of, I mean, the people around me, we are we are doing this on an average. How many minutes can, if we are using age range, a child between the ages of 2 and 4 on an average, how many minutes can they stay in front of a TV?
So that one it will also depend on whether the child is showing traits of autism, right?
Okay.
So that one you want to take off the screen. So even you, the parents, put off that TV in the house. You are not going to see. You are not even going to watch news. But if there's a
Really?
normal, yes, yes,
Doc, wait, oh, wait,
yes.
wait, 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 wait. I remember was either you or the speech therapist mentioned that if they are watching human beings, that one is fine.
Okay, so it depends.
Yeah.
If the human being will give the child the opportunity to talk back, then that one is fine. But we don't want to do the screen time. Okay. If the
Okay.
child is on the spectrum, we want to limit the screen time. But of course, if the child was doing, let's say, 10 hours of screen time a day,
Mm.
and then you are limiting screen time, you don't want to go from 10 hours to zero. Maybe
Okay.
you want to reduce it to maybe 2 hours a day. Right. But I would say that if the child is showing signs of autism, just put the screen out. And you
At
don't
like off
just put it off. You see,
completely.
the child will forget about the screen. You don't say, okay, Kojo, you cannot watch the screen. Go and sit in the corner. No, there will be trouble. So the screen is off. We are all going out there. We are going for a walk. We are changing our environment. You can even let them go to grandma in the village. Let them go and play with the village. By the time they come, all those social interaction issues, it is gone. Right.
Oh.
So for some of the children, you have to be very strict, especially if you're able to catch them earlier and you are hoping that their symptoms will improve. So I was speaking with this senior colleague, neurodevelopmental pediatrician, and she said that there was one child like that who was on the spectrum, and then everything got better after the interventions. And the father is an IT specialist, and he wanted to introduce his child to coding and
Hey.
all that. So he asked her, "Oh, doctor, can I reintroduce my child to the screen?" And the doctor said no. I thought the doctor was being too harsh, but I said, "Oh, maybe they should retry it a little and see if the child's symptoms will come
Yeah.
back." And she said that the children who they retried, they started showing symptoms. So she
Hey.
advised that father that he should look into maybe engineering and other things, not the screen. But I think that we can take, you see, no two children with autism are the
The same,
same.
yeah.
Yes. So we can treat it on a case by case basis and see, right? Maybe for
Wow.
me, I would say that, okay, let's introduce some screen time and see if the child's symptoms will come back because the child too has to learn how to use the computer.
Okay.
But
Doc, there, let me just quickly read through these. There's a question for you. Okay, so Nanaya Wanta says, loving the show. Thank you for watching. Mamia Bastokes, I see you, girl. Um, so we have a question from Tickles and Giggles. This is on Facebook. What if your child is fond of running off when you and the child are at the marketplace or a busy environment? I think you mentioned Makola. And I had a question for you when you mentioned the Makola thing, and somebody is asking for us. So when the child, is fond of running off at the market or a busy environment, how do you address that? Or do you find alternative ways of encouraging outdoor sessions?
yes. So so this Makola one was this by this new pediatrician. That was her recommendation, and she sees great results. She said by the time they do the third trip, the child has improved. All those photosensitivity and sensitivity to loud noise is gone. So I think that she really is like you flood the child with the thing that the child fears. But
Mm,
if you are taking your child to Makola, knowing how busy Makola is, and you know that your child too is quite aggressive and will run off, then you have to also go with maybe an extra help who would
help.
probably hold the child. Or you may also want to start with a market that is not too crowded. But they do have to get the outdoor exposure. They have to
Yeah.
get the outdoor exposure. They have to get the outdoor play. They have to get the human interaction. So we can take it slow at a time and see how that particular child um, reacts
Well,
to
yeah.
that environment.
Okay. Okay. Mona Lisa Sabin SL says, leaving or taking your children outside is becoming scarier by the day. I totally agree, sis.
Me too.
So Bismarck is watching. Thank you for watching. Now Prixie Appiah is saying, oh, that's you have that name. This is your twin. Hello, Ifwa. God bless you for this. Please, I would like to ask, doctor, if a 3-year-old child is only sensitive to loud sounds, but the child speaks quite well, can it be categorized as autism?
So with just these two symptoms, I would not say no. I
Okay.
wouldn't say that the child has autism. Coming to
I
the
think it's just one,
just one.
yeah, loud noise,
So
loud
no, your
sound.
child does not have autism. I cannot stick my neck out and say that the child has autism. But if you are concerned, then you bring the child, then we, examine the child, take a history, and use our screening tools on the child to see. But I wouldn't, the child is speaking, can have human interactions, can share her toys, I don't think the child has autism. So I want to say that it is not enough to just use one sign to diagnose autism because it is a lifelong condition. So you don't want to say your child has autism when you haven't really done the right screening to arrive at that diagnosis.
Mm,
So if the father is concerned, you should bring the child for us to screen properly. But I don't think the child has autism just
autism.
by listening to this.
Okay. Now, Nanaya will answer. Well, Prigzy, I hope we answered that question. Nanaya answer is asking, after an intensive treatment, what improvements do you expect the kid to have?
So some of the children, they really do improve. Some too, you don't see much improvement. No two children are the same. Each child is unique. The children under 3 years, they usually do that very well. Okay, so some of the improvements that I see, sometimes within a week of starting the treatment, you take them off the screen, you get some outdoor exposure, some sun exposure. Sometimes we tweak the diet to include foods that boost brain function. And sometimes within a week, you realize that the child is calmer because many of them they are a bit hyperactive. The child is calmer. The child is maintaining eye contact now, right? Now, some of them too will start to vocalize. So if you had a child who wasn't saying anything, they will start babbling, cooing, they start vocalizing, right? And then they will also start speaking one or two words. So you can see this very quickly, but it depends on the severity. So those who are mildly on the spectrum, they recover very quickly compared to the severe ones. But the children that we see late after the age of 5, some of them, whatever you do, they cannot vocalize
because it has gone on for long.
because they have not even used their vocal cords for a long time. So I don't know if the brain forgets that the vocal cords are for speech. So those children, you have to find other ways to communicate. So there are cards that they have to be trained to use so that they can communicate their needs. So it's the best thing is to get these children very early. So those young children, you can actually see a reversal of symptoms. And then you say, oh, maybe the child didn't have autism in the first place, but the child has completely recovered. Then the child doesn't even meet the criteria for autism. But those that come in late, but even then, if you are taking the child at 7 years, they can still make improvement because some of them, they can engage in destructive behavior. They'll be banging their head, scratching themselves, throwing tantrums. So when you start the intervention, they actually calm down. So they may not vocalize, but even their behavior becomes a bit more manageable for the whole family.
And I hope we answered your question. Now, Mona Lisa is also asking, please, is it possible to screen a newborn for autism?
So usually there are different screening tools. Some of them are very simple to use. So there are some screening tools that start around the age of 2 months.
Okay.
So yes, so you go through what a 2-month-old is supposed to do. So 3-month-old. So that's why I'm saying that every weighing visit, you can actually have something to screen for a child. So let's say if you have a child with autism, you have an older child, and you have a new baby, and you want it to be picked early, then yes, by all means, bring your newborn.
If you have an older child who is autistic.
Yes. Okay. And then you're having a new baby because there are some families where they have more than one children, maybe 3 children, all on the spectrum. Because autism, there's a genetic component to it, and there's also the environmental component. So maybe for you are a mother with a child with autism, and you are having a new baby, and they want the baby to be picked early so that the interventions can be done for the baby. Then by all means, bring your newborn. Usually we start the screening around 2 months, but you bring your newborn. Right.
Okay. Doc, there is also this stigma when it comes to autistic kids. Some people don't even want to. It's recently that we even see that people are communicating with autistic kids. First, it was like an abomination for somebody to be autistic. What would you say about that?
We have to learn to accept the children with autism because they are normal children like everybody else. Okay. They have feelings. Sometimes they are not able to convey their feelings and their needs. So they seem different. But there are also different kinds of neurodevelopmental issues that are not necessarily autism. But because we do not know so much about autism, we lump them all together as autism. And then we stigmatize them. Anything that is unusual to our normal behavior, we say that, oh no, this one. That is human nature. Probably it is a way to protect ourselves or something. Maybe a primitive reflex to defend ourselves or protect. But we don't need to stigmatize children with autism. If you're a parent and your child has signs, just go out because there is help for the child. Ghana, we don't have too many neurodevelopmental specialists. We don't have even this region. We don't even have a resident speech therapist. There's somebody that goes and comes from Accra.
And that is very dangerous, honestly. Yes. It's not only uncomfortable, it is dangerous. Because how can a whole region have no speech therapist and parents have to now pay, even for you, for your occupation in this region? Can I say it is just you?
So there were 2 of us no, it's not just me. There's Dr. Paintel in Takwa. She's a pediatrician in Takwa. Okay. Then there was Dr. Appiah Nkansah. she was with me at Appiah Nkansah Hospital, but she's gone back to Accra for further studies.
So it's just you now.
Now it's just me. Then there was somebody who came to Daboase, a
Okay.
pediatrician, recently, but he didn't spend 1 year. I heard he has left the country
Please,
for
we will just
greener
plead
pastures.
with the government that please come to our aid. I mean, when it comes to these are the things you people should be doing for us to vote for you. These are the things we need for you to do for us. These are critical things, issues that need to be addressed. We beg you, come to our aid. Provide the resources for the people in this region. I'm going to ask you my final question because our time is fast spent. And then we go for our sign language lesson. People with autism, let's say the kids, can they ever be independent? Can they grow and have normal lives?
Yes.
Really?
But it depends.
Okay.
So some of them go and have their job. So there are some doctors and they are on the autism spectrum. So those with mild symptoms, they're able to have a normal and independent life, right, with the interventions. And then some of them to have other associated problems, right? So they would need help for life.
Besides the autism, they may have other
They
conditions.
may have other conditions with the autism,
Okay.
right? So some of them is genetic. So they have a genetic component to it. So they have a major disease and then they have the autism. And some of them too, they are severely autistic. So they need help forever.
Hey, Doc, wait. Oh, I said it was going to be my last question, but when you mentioned genetic, if somebody has a child and the child is autistic, what's the probability that all the kids the person will have will also be autistic?
I cannot tell. I cannot speak on that.
Okay.
But there's this gene. I don't want to be too technical.
Yeah.
Should I mention the name of it?
Mention and then you
So they say
explain to
there's
us.
the MTHFR gene.
Okay.
And then in some individuals, there is a mutation. So there's something wrong with the gene. So when you have a problem with that gene, you have difficulty metabolizing or making use of certain nutrients in the body that are responsible for DNA repair, brain repair, and also detoxifying the body from heavy metals. And heavy metals, we are eating it in our pesticide-grown foods, galamsey drenched drinking water that we are using for soups.
The fruit juice. The other time you were talking about fruit juice. That one too.
After the fruit
the one
juices,
that we give the kids to school.
After the fruit juices, some of them do not have any fruit at all. You may have a bottled drink that has maybe grape on it, and the mother might think that it is grape juice, but it's just grape flavor, color, and sugar. You see, and maybe your child is already on the spectrum. Sugar too makes them hyperactive. So you realize that the child, after drinking a bottle of sweet drink, becomes hyperactive. So you want to learn to read your labels so that you clean the child's diet, because all these chemicals will be absorbed straight into the bloodstream. Blood will flow everywhere and send the chemicals to the brain. The brain will start touching. You understand? So you have to read our labels and then give the child real food. So if the thing you are giving the child is not real food, think again.
Okay.
So that you flood the child with proper nutrients.
Okay.
Right.
All right then. All right then. So we will go for a short break. When we come back,
the two worst moms. 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 The two worst moms.
I'll be taking you through an interesting lesson for today. The words that I'm going to teach you are mom,
You can't hear.
mom, dad, dad. So we have learned two words today. They are mom and dad.
Okay, people, welcome back. I hope you learned that sign language. Me myself, I am busily learning. Doc too says opedosia. Serious. Sign language to help our communication even with every other person. Doc, I'm going to ask you. My viewers are having a lot of questions. Since maybe so before we go for our game segment, okay. Somebody says, and I think you were saying this when we were off, at which age you notice, let me make this two in one so that you answer everything and we sum it up. At what age will a parent notice that the child has autism? And then another person is asking, how long should the treatment go on? Secondly, are there any side effects to the medical treatment? This will be your last question.
Okay, so it's the first one is at which age
Yeah.
can the parent diagnose autism in their child?
Yes.
So the answer to that is the parents cannot diagnose autism in the child.
Okay.
So autism diagnosis doesn't just come, it's not a one-off thing that you just see the child and say, oh, this child has autism. So the child may have certain traits that point to
So
autism.
at which age will we see that?
Even from 2 months, 3 months. You see, for the parent, your job is to look at the child's development. And it is easier when you have older children. So let's say a 3-month-old. A 3-month-old should quieten to the mother's voice. Yes. Or even, so you have a 3-month-old does not quieten to your voice. Like, my child's development is a bit delayed. You are a 4-month-old, you should be cooing, you should be babbling. And then you are just there at 6 months, you don't make any sound. So you can tell that this child, you understand, is a bit different. This child is a bit slow. Then you see that these are delays in the development. Then you now come. So depending on the age at which you present your baby or your child, then we use the screening tool appropriate for the age and see. So you can even decide that your child is fine, but you still want the child to be screened. So 2 months, you will get questions to ask.
Okay.
3 months we can screen, 4 months we can screen. So if there's anything, we can start with the intervention.
Okay.
Right.
Okay.
So it doesn't matter the age that you think that your child has a problem. Just bring the child for the child to be screened. The diagnosis of autism is not an easy one that you just
see the child.
Sometimes it is anxiety. Sometimes it's just a speech disorder. So they have to go through the screening tool, then the diagnostic tool before we can say this is true autism.
Okay. So how long does the treatment take?
So that one, it depends. So as I said, some of them they are mild, some of them they are severe. So if you have a child who has mild autism, for example, you are going to start some behavioral therapy, you are going to start occupational therapy, you are going to get your outdoor exposure, we are changing their diet. I have seen children who seem to be on the spectrum, and within 2 weeks, and they were not talking, and they were walking tiptoes, and they were hyper and all
the
that.
tiptoes is also part of
They have some typical behavior. So it's not
okay.
every single child that will walk tiptoe. So when you see it, that doesn't mean that your child has autism.
Okay.
But your child may have a neurodevelopmental problem. So bring the child, let's screen and see whether it is autism
when your
or
child
not.
likes to walk the tiptoe.
So it's not just a tiptoe.
No. But sometimes there are some children, it's very evident. They like doing it every day. That's how they want to walk.
If you are not sure, just bring the child. Let us screen.
Okay.
So and for some of the children, within 2 weeks, I had the child. I've actually had 2 mothers whose children talk like within 2 weeks, and they were fine. Some 2 years up till now, they are still doing speech therapy. They are doing occupational therapy. They have not seen any improvement. So it depends on the severity. So I cannot say for sure that maybe you're going to do 2 years. Some of them, you do a few weeks therapy. Fine. And they don't meet the criteria for autism again. It's like it has reversed. And usually this happens in the younger children, the less than 3-year-olds. But the older children, it's a bit difficult. Yeah.
So are there any side effects to the treatment?
The treatment, so somebody asked about the medical treatment. So as for the medical treatment, sometimes they may have certain issues, maybe anxiety, hyperactivity.
Due to the treatment?
Not due to the treatment, associated with their autism.
Okay.
And then for which reason they may need a certain amount of medicine. So let's say you have children who cannot sleep at night. They will go up and down, up at 12 midnight, they are still awake. Melatonin deficiency. So sometimes the doctor will now prescribe the hormone that I talked about, that the sleep hormone.
Yeah.
So prescribe it. And then they're able to sleep a bit, right? Melatonin, but of course, it's not a natural melatonin, but it will help them to sleep. So maybe they will do it for a few days, and then they come off. Because you are taking off the screen time, which is also depleting the child's melatonin. Please understand. So as you take it off, the child will also improve. So some children really improve quickly. They don't have to do the melatonin. But for some children, they have to do a lot. Some children, they are so hyper, they become even a danger to themselves because they are hurting themselves. So you may have to put them on certain drugs. As for the drugs, depending on the drug, some with a side effects. But whatever it is, the parents will be taking through the side effects, and they will see what is best for that particular child. Yes.
Doc, this is the end, not the end of the show, but the end of the discussion. I'll bring you back. I'll bring you back. But please, what's your final word to young parents whose kids, may be going through this phase, whose kids may be experiencing autism?
I even want to congratulate them because they are doing good jobs. But I want them to understand that there is help available. Although it's a lot of work, but there's still help available, so they can talk to somebody. I mean, Appiah Nkansah Teaching Hospital, you can come to Appiah Nkansah Teaching Hospital and ask to see the pediatrician, and then we can screen your child if you have any concerns. It may not even be autism. It may be maybe an anxiety disorder or a speech delay that with 1 or 2 interventions and some speech therapy, the child will be able to talk for you.
Okay.
So we should not stigmatize these children. It can be difficult. Sometimes you take a child like that to church and they are disrupting service. Yes. So nobody will tell you that don't bring your child. You yourself, you know that you're not taking. Yes. So it's very difficult. So, but we should know that there is help available. So let us seek help for the children. Let us seek help early too. So you can always ask for your child to be screened, no matter how young the child is. 3 months, 4 months, 5 months, 1 year, it's fine.
All right then. Thank you very much, Doc. This is the end of our discussion. We'll be right back for the game segment. Just wait. We'll have a lot of fun. Doc, are you ready for me?
Yes, I am. Are you going to play football?
The two worst moms. The two worst moms.
Segment. Now, on this segment, Doc and I are going to play a game. See, Doc has 3 kids. Me, Steph, I have 3 kids. We have some diapers here. We have our beautiful dolls. Me, my kids are Rasta, so I'll stick with this one. So, Doc, do you have your diaper?
Yes, I have
Okay.
my diaper here.
So, you have your underpants and your dress.
Mm-hmm.
So, please, producer, we need 40 seconds
Hey.
to see who will dress their doll first. Okay, we want to see who the fastest parent is. If I win, no, if Dr. Nkansah wins, she's going to give me 30 CDs. I just want 30 CDs. If I win, I'll give her some 2 CDs. If she wins, I'll give her some 2 CDs because she's a rich woman.
Hey.
Doc, you're a rich woman.
Amen.
Even the 30 CDs price, not I should make it 100 CDs.
Don't worry.
So please, can you time us? Can we start now? When should we start? Producer, please, can we start now? Okay, we are starting. Doctor, Doc, don't do any other. Please keep us updated. How many seconds do we have? I'm not even able to. Hey, this is too tight.
It's too tight.
Hey, so please next week give me less tight. Hey, that Nkansah will win. No, God. Hey, 3, 2.
Hey.
Oh, time up. Doc,
Time up.
time up. Oh, next I didn't win. No, but I would have won.
Let's see.
Oh, Doc. Hey, Doc, you're done. Hey, this is not fair. Anyway, time up, time up, time up. So, this is just for fun. This is just we doing it to see. Oh, Doc, Doc, you
Okay,
summoned the
nice.
gods from your hometown to come and help you.
Ready to go to school.
Hey, why you late? Anyway, you can contact Eniwaso. You can find them on IG as well at Eniwaso Garments. They have very, very beautiful dolls. I feel so proud that this is made right here in Takrady. We didn't import this from any Western country. Thank you so much. We will be right back. Hey, Dr. Thing. Finally. You can go. Welcome back. As you can see, I won the game. People didn't see. Yeah, I have 4 eyes, 6 eyes. I see beyond. If we had done this in the future, I would have won.
I believe you.
Anyway, Doc. So this is a small package from Cocados.
Oh.
Okay, so in the whole Ghana, see, if you are on a fitness journey, even if you're not on a fitness journey and you want to eat healthy for yourself, like doctor is saying, even autism is associated with a part of the gut. So what you consume, what you take inside. This, I'm sure this is beetroot juice. And the way you love beetroot, I just knew this was a perfect gift for this woman. Cocados is right here in Takrady, but any part of Ghana that you are, if you order, they will bring it to your doorstep. Is it Burkina? Is it healthy smoothie? Is it granola? Is it Greek yogurt? Me, when I started my weight loss journey, it is only parfait that I've been eating from Cocado. So you see how my skin has been glowing recently. Aha. They are sponsoring this show. So if you want any healthy food, or any health food shop right here in Takrady, contact Cocados. You can find them on Instagram and on Facebook at Cocados. 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 And then, of course, thanks to Eniwaso Garments, and then appearance trendy wardrobe. They have all the cookware that you need in this world. If you want your kitchen to be beautiful, they have air fryers, microwaves, fridges, everything, and then they have trendy outfits too, as beautiful as what I am wearing. Thank you all so much for sponsoring our show. So, Doc, you have your, I think this is Greek yogurt here, and your beetroot juice from Cocados.
Thank you,
Now you
thank you.
come and testify that Elisha, what you gave me was
Hey,
really
I
good.
do cocados with my children. Usually
Oh,
Fridays when I pick them from school,
you
they
heard.
will go there.
I didn't even have to talk.
Somebody-
She already does it. She already does it.
So thank you so much.
You're welcome. You're welcome, Doc. Thank you so much. I'm so honored to have you. I really appreciate your time for coming in. But you know, I'll bring you back.
Oh, you're welcome. I'll be glad to grace your platform again.
All right then. Thank you. Thank you to everyone who made time to watch our show today. I am really grateful. Same time next week, same place, okay, at Two Words Moms on YouTube and on Facebook. You can also follow us on TikTok and on Instagram. Thank you for watching. Enjoy the rest of your day. Mwah.
The two